Now we're going to move on to your insurance policy provisions. And as you can see, I have put some graphs in there because you're going to get tested on the mandatory provisions. And there's going to be 12 that are mandatory. There's going to be 11 that are optional. And they come under the Uniform Individual Accident and Sickness Policy provision. Trust me, your test is never going to use that whole phrase. They will say the uniform provisions. Well, just remember, nurses wear uniforms, so they're talking about on the health side. But just like in your life insurance side, when there's provisions that are mandatory, because remember, everybody writes their own policies. There's only 12 in the individual health and disability. They have to be the same. Well, the wording has to be equal or more favorable. It cannot be less favorable than what you see there. But if it's more favorable, the price goes up. Now, I put the provisions there and little keywords to help trigger. There's only a few that are showing up, but they rotate all the time. Now, after you've reviewed that, what I'd like you to do is once again, pause, answer the questions, and once again, underline the keywords that brought you to your decision. Do it in pencil in case we need to change anything, and then we will go over it together. So it's time to start thinking. Okay, now let's go over and see how you did. Number one, which of the following is a correct statement about the premium modes? Now remember, premium modes means frequency of payment. Well, what happens here is you're going to get questions here such as semi-annual costs more than annual. All right, so the more frequent you pay, the more it's going to cost. So in your test question here, or your answer out of your examples, then quarterly costs more than semi-annual. Number two, co-insurance, co-pay, and deductibles are all examples of cost sharing in health insurance. True. Co-insurance is when the medical bills are being split 80-20. Co-pay is what a person pays before they receive services, and then the insurance picks up the cost of the service. And deductibles means you're paying the first part of your medical expenses, then the insurer pays. Now, three, which policy provision protects an insurer against a lawsuit before the insurer has reasonable opportunity to investigate? Well, that would be up in the chart that was given to you before this, and that would be legal actions. Remember that the person needs to wait at least 60 days, but not more than 3 years, to bring legal action against their own health or disability carrier. Now, number four, insurers are prohibited from denying claims based on misstatements in a disability policy application after the policy has been in force for, the answer is 2 years. Where I stumbled before up there, it means this is known as the time limit on certain defenses. In life insurance, it was called the incontestability provision. Now, five, the entire contract, grace period, and reinstatement are, if you look at the top, those are mandatory provisions. Now, six, a payment paid by the insured to the provider of the service is a copay. And then, let me move this up now. Then, seven, under the Uniform Provision Law, then other than weekly or monthly, the grace period is 31 days. True. Other than means except. Now, make yourself a note because sometimes it rotates in a scenario. Now, it is a grace period of, on your weekly policies, of 7 days, on your monthly policies 10 days, and on your other modes, which would be quarterly, semi-annually, and annually, it's 31 days. So they may give you a scenario, and you just remember the number, and they'll say, well, they submitted the claim, and you'll have to determine if it was paid or not paid. Now, 8, there are how many mandatory provisions? The answer is 12. 9, the entire contract must consist of the application, the policy, and any riders or modification. The entire contract provision addresses changes made to the policy. And remember, only the insurer can make changes, not the agent. Now, 10, under the provision law, an agent has the authority to make changes to the contract. The answer is false. Only the insurer can. And what provision is it? It's called the entire contract provision. 11, if the insured is in the grace period and requires treatment under the disability provisions, they must do what in order to make sure the claim is paid? Pay the premium. Sometimes the answers are that simple. Now, 12, if a reinstatement application is required, the policy is considered reinstated after 45 days if no action has been taken by the insurer. Now, that type of question comes and goes, and it says that an agent came out to reinstate the policy 50 days ago. Which of the following statements is correct? Well, they are reinstated. However, we need to move on to the next one to get the correct answer. It says when a policy is reinstated under the provision laws, accidents are covered immediately, and sickness or illness would not be covered for 10 days following the date of reinstatement. So back to the test question is they would have been reinstated only for accidents. They had 5 more days before they were also reinstated for illness. Now, 14, a policyholder must notify the insurer within 20 days or as soon as reasonably possible. And then 15, the notice to the agent equals notice to the insurer. That's true. The company, meaning insurance company, must supply claim forms within 15 days of receiving a notice of claim. Now, 17, the claimant has 90 days from the date of the loss to submit proof unless legally incapacitated but not to exceed a year. Now, what that means is how I remember it as 90 proof. But if you will put it in a locker combination, 20, 15, 90, that will help. So 20 days to notify us, 15 for us to get them claim forms, and then 90 days to get us back the proof. Now, your next one would say 18. Under the provision laws, loss of time benefits cannot be paid less frequently than monthly. Remember, underlying loss of time, that means disability income. So the longest you have to wait for a disability income check is 30 days. Now, your next one is going to be, when we start paying you. Don't forget, you still have to do your elimination period. The next one is going to be payment of claims, reinstatement, pre-certification, and grace period are mandatory provisions. Well, they're false because of pre-certification. Pre-certification is a cost containment method that's used on your health plans where you send in, if it's non-emergency surgery, that you're going to have surgery, and then they approve before you go have the surgery done. Now, 20, cancellation, change of occupation, and misstatement of age are optional provisions. That is true. Now 21, under the change of occupation provision, a change to a less hazardous occupation increases benefit. False. It reduces premium. So remember, if you go to a more hazardous, it reduces benefit. Less hazardous, it reduces premium. But if you do two things, even if you only do the one, once a year for pay, we always rate you on the most hazardous. And normally they like to make the comparison between firefighters and school administrators. So if you are a part-time firefighter and you get paid, then that's going to rate you as a firefighter, not as a school administrator. Now your next one is going to be, let's see, this reads poorly, but insurance with insurer and the other insurance provisions help prevent overinsurance. This is true, meaning the optional provisions that they could put in could say that if you have more than one policy with this particular insurer, choose which one you want to get paid from and we will refund the premium on the other one. The other two phrases would say under other insurance, if you have other health insurance we did not know about, we will pay a portion and then refund a premium to you for the part that we're not going to pay you for. And the other provision has to do if we find out you have another disability income policy, we will also reduce your benefit, all to make sure that you're not overinsured. Now 23, right to examine or free look is normally 10 or 20 days and 30 days if the insured is over 65. True. Now another thing that's going to go is that's a provision for the class of disability. But you may want to make a note, disability income in California must give everyone a 30-day free look. And all products sold to anyone over 65, the minimum free look is also 30 days. But that's a general question. It didn't zero in on disability income. That's why it's true. Now 24, war, suicide, self-inflicted, workers' comp, and maternity are standard exclusions in individual health and disability policies. True. And 25, all health and disability policies are written either occupational or non-occupational. True. Remember, they either write you to be covered both on and off the job, that's occupational, 3 O's, on and off, and or non-occupational means it only covers you off the job. Now, since most of your individual policies are written occupational, what happens is that's one of the benefits of having an individual policy. 26, the insurer may refuse to continue beyond the policy anniversary or next premium due date is called optionally renewable. Now 27, the policy may be non-renewed or terminated at any time by either the insured or the insurer is the cancelable renewal provision. Now 28, the insured has the right to renew for a specified number of years or to a specified age, and the insurer has the right to alter premiums by classification is the guaranteed renewable provision. Now remember, if you're looking at my chart, everything but non-cancelable can be changed by classification. But for test purposes, you associate that only with guaranteed renewable. Then 29, an insurer can refuse to renew only when a condition in the contract is not met, is referred to as the conditionally renewable provision. 30, an insured can renew to a given age and premium cannot be altered is non-cancelable, which is the best you could buy. Now sometimes the test will say non-cancelable and guaranteed renewable. Well, it works the same as when they put them together as a non-cancelable policy. It's kind of redundant, but I think it's done to confuse you. And the next one is going to be 31, and it says the classification of renewal that does not allow premium increase is non-cancelable. And if when you were taking your test, you slowed down here and you had to really think about that, that's the trick where they give you two questions where the answer is still going to be the same for both. And normally that's not how tests work. So that's why you were a little taken back with it. Now 32, the least expensive renewal provision is cancelable. Now what's really sad here is you're going to hear people that said, I shopped my insurance and I got it for 50% less. Well, what probably happened is they got a lesser definition or a more restrictive definition and does not realize what it means when it comes to claim time. That's why it's so important for us to have proper training so that we go out there and help the client, because your life, health, and disability products, you do not shop by price. You shop for definitions, you shop for benefits, you shop for guarantees. Now, 33, the last question is, a policy can be both occupational and non-cancelable at the same time? True, because occupational and non-occupational just tell you if you're covered on and off the job on your policy, and non-cancelable, or those other renewable terms, just indicate whether the insurer can cancel, non-renew, or change your premiums. And these will be all on the front of the policy, so you'll immediately be able to tell the client what they have. Well, we've just finished another one.